We'll now move into our panel of examples of mobile technology being used for the Medicaid population. Our first speaker will be Erhardt Preitauer, CEO of Horizon New Jersey Health, which serves about 1 million Medicaid and Medicare members in New Jersey. Under his leadership, Horizon New Jersey Health has become a national leader for its managed long-term services and supports program, and we're so pleased he's with us today to share their award-winning and innovative use of mobile technology in this program.
Thank you, Catherine. And I'm joined here with Jerry Boone, who runs much of our managed long-term services and supports program. So just a quick introduction. We oversee about 1 million government programs members, and you see that at the top of the slide. About 700,000 Medicaid and about 140,000 age-blind, disabled, or managed long-term services and supports members. And we've been serving these more challenging and technical populations for several years now at this point. Part of why I came to New Jersey a few years ago was really because we had the opportunity, I think, to build, from a long-term care perspective, one of the best programs in the country, in my opinion. And I've had the opportunity to work in many, and we'll certainly talk more about that in the following slides. So I think one of the things that's important as we think about technology, I mean, it really is an enabler. And I think this statement really summarizes sort of our viewpoint. And it's very important, I believe, from a cultural perspective for an organization to really think of themselves a little bit differently when we're working with some of our highest needs members of our society. Dr. Berwick talked a little bit about that earlier. And I think our approach and sort of what we're going to go through here really shows that proactive care management with mobile technology really can work and drive down costs and increase quality at the same time. So we really look at ourselves in terms of bringing the whole health plan out to the member. We think of ourselves as a social agency, and then, of course, being able to leverage technology. And it's certainly been recognized. We're very proud of the recognition that has been recognized by some of our partners. One of the groups that has moved into managed care in the last couple of years are the TBI folks supported by the Brain Injury Alliance of New Jersey. And in fact, they've are recently recognizing us for the great work we've done in terms of increasing the coordination and quality to the members that they serve and minimizing disruption. And then, as you can see to the right, we've received some technology awards from a couple of leading publications that we're very proud of as well. So this next slide is kind of an overview. But in a nutshell, what we've done is we've taken the full power of a health plan and we've made it mobile. So we're able to take a mobile system out into the community where our members are, under bridges, in their homes, in nursing facilities, and perform basically all of the functions that we could in our office in a health plan. But what that does is really important. It fundamentally changes the conversation that we can have with a member, because we can see in real time practically everything that's going on with that member. In addition to that, what's very exciting is we can perform assessments real time out in the field, and behind those assessments we can dynamically create care plans, and behind those care plans we can actually even have the care coordinators trigger authorizations and order services. And one of the things that we're really proud of is the care plans and the services and the providers that we're talking about go far beyond just the traditional providers. We've put a lot of effort into the community and the social service and the providers that are in the communities that we're serving. So it is truly a very holistic approach that we take out to the member. But doing that's very, very tricky. And I'll give you an example, a couple examples, and I think Jerry here will have a couple of examples as well. It's not easy, right, to take a mobile device out and have all of that access. I'll give you a few examples. We have to have our nurses out in the field with Wi-Fi access, and they have to have telephone access. Some counties in New Jersey have the ability to have a phone where you can have Wi-Fi and phone at the same time. Other counties in New Jersey will only allow you to have one. So we might have a nurse that is halfway through her 500-question assessment, and she receives a phone call and gets kicked offline. Obviously, that can't happen, so we've got to be able to plan for that. There's a lot of those little nuances as you go through workflow and planning that you've got to be able to manage. It sounds like a minor deal, but obviously you can only imagine the frustration that a nurse might have if they're halfway through a 500-question assessment. And then, of course, not to mention the inconvenience to a member. What happens if you're in an apartment building and you can't get any connection whatsoever? All of our assessments are able to be offloaded onto the hard drive of the computer for a short period of time. But if you do that, what about security, right? Security is a huge deal. Tons of sensitive information. We've all read about the challenges that some other health plans have had around data security, and certainly our data security people struggled a little bit when we told them that we were going to take all of this out into the field. But you've got to have the highest level of security around all the sensitive information that we have access to and the sensitive information that we're gathering for our members. So there's a lot to think about as we look to take technology out into the field.
Hi, everyone. This is Jerry, and just following up on Erhardt speaking about the offline capability, you know, that was really key in a lot of our successes, having that offline, so the care manager can fill out the assessment. As soon as she's back online, she exports that document right into our medical management system. It is key that we have everything that we need to know about that member at our fingertip. We have claims information, we have pharmacy information, we have their backup plan. We have the most up-to-date information. We regard ourselves as being a paperless care management system, that we're not carrying folders and mounds of documents with us, you know, that could put us at risk for losing PHI on a member. Everything is within the system. But most importantly, we have access, members have access to us 24/7, and in that access period of time, that care manager who may be caring for them may not be the person on call or may not be available to take that member's question or inquiry or identifying a gap in care. No matter who that member speaks with, they all have access to that member's information, and in particular, their care plan, their backup plan. So if something should go wrong out in the community, they can act on that immediately. And that's really key for us to really making sure that on a 24/7-day basis, we are providing the best care that we can give to any one of our members.
And, you know, the bottom line is, you know, taking the power of a health plan out to the field is tricky, but one of the things that we're very proud of, and this goes again to Don Berwick's comments earlier, is technology is supposed to help make things simpler. And I've been involved with several launches of ABD, or Managed Long-Term Services and Supports programs. And when we went live with the program in 2014, we launched, I think, probably, about 175 care managers out into the field, plus or minus at that time. Brand new technology, brand new job, brand new processes, and I think our turnover was less than 10% for the first year, which is tremendous, especially given the experience of some of the other health plans in the market. But really, the key to that was good support, and it was really leveraging technology to make the care coordinators' jobs easier, not harder. And I think that was a key element to being able to be very successful. And you can see off to the right just some statistics about what we've done over the last 18 months in terms of some of the activity. And on that notion of activity, picture this. For our more complicated members that we manage in the community, either through our internal policy or our state contract, we have roughly 20 steps that we have to manage depending on what the members' needs are. And most of the steps have some level of interdependence. So we get a new member, we've got 3 days to reach out to schedule an appointment, then we've got 5 days to see them, so on and so forth. And so it's critical that, number one, you're able to manage productivity. We've got a lot of folks out into the field. And number two, be able to manage compliance. And so we've built a great tool set, really the best that I've ever seen, where each care coordinator, each supervisor, each manager, through their mobile device, can open up these dashboards and focus exactly on what they've got to do for that day across their entire caseload. So it's really an amazing tool, and something that our entire organization uses very often. But again, it's an important part of the entire mobile picture that we use. There's one innovation that I want to highlight that we think is important, that we're very excited about, and this plugs into our overall strategy. And this is using an app, basically. So personal care assistants for non-skilled home care, obviously a very important part of the post-acute long-term care ecosystem. And there's a couple of opportunities within this provider set that has brought about this innovation, which I'll talk about here, around an app. So number one, we ask ourselves, is there a way to leverage the personal care assistant to drive quality in the home? We think about who has influence over the member. These personal care assistants often are with a member several times a week, several hours per day. So that's a question that we thought a lot about. Also, if there's a change in condition in the home, could we get that information from the personal care assistant? We think that the personal care assistant, practically better than anybody, knows if the member's changed or if something in the environment has changed, if there's food in the refrigerator. So how do we leverage that information? From a health plan perspective, I'd like more visibility onto what's going on in the home, what the care plan that they're carrying out is. And of course, there's a lot of focus on reducing fraud, waste, and abuse. So we've created a pilot with Beata, and Sync is the company that we partnered with to create this, where personal care assistants are able to go with a mobile device, so a smartphone. They're able to open their appointments for the day, have the software give them a map, very easy. But when they check in, when they walk through the front door and they check in, it obviously geostamps them, so electronic visit verification, not a huge deal. It geostamps them, and then it asks them, pushes them a message. Hey, if you can get your member to go to a primary care provider in the next 3 weeks, we'll give you $30, something along those lines. And then the personal care assistant goes through their daily tasks. They fill out their care plan in the app so that we can see that. When they're ready to check out, they check out. Again, it geostamps it. And we ask the personal care assistant if there is any change in condition, realizing that these are non-clinical folks. And then if they say yes, however, that information comes directly back to the health plan. And then, of course, we can have the member sign off or thumbprint or picture as a validation that the service has happened. So relatively basic from a technology perspective, but connecting the health plan, the agency, the member and the personal care assistant in a way that we think is unique, in a way that can drive quality, in a way that we think will get the health plan better involved and reduce fraud, waste, and abuse. We're very excited about that. We've run the pilot since early October. The data is very clear. This is working. So we wanted to share that with you as well. Any additions?
Nope, I think you covered it.
Well, finally, you know, the putting it all together, I think, again, sort of ending back philosophically speaking, we think our care management staffing, how we staff them, the ratios we staff them with, really were best in class. So we really invested in our care management capabilities, the technology, and the people, and the experience. We've got Jerry and myself and others with a lot of experience in working with challenging populations. So bringing all that together, and again, the data is out there, and our medical expense is sort of the best in class here in New Jersey. So I am super proud of being able to say we invested more in caring and working and supporting and coordinating for these members. We invested more, and the outcome is lower cost, and the quality metrics that we're looking at are very, very promising as well. So that's a quick overview of a little bit about what we're doing at Horizon in New Jersey.